Hey, this is Doug Field and Ron Bachman. Welcome back to Healthcare Consumerism Radio. We're excited about this segment. We've got on the line with us Joseph O'Brien, CEO of Interactive Health, a leading provider of outcome-based wellness and health management solutions out of Chicago, Illinois. Joseph, good morning.
Good morning, Doug. How are you?
We're good. Good to have you here. Can you tell our audience a little bit about Interactive Health?
I sure can. A real quick way of doing it, we help people change their lives, and basically that's kind of our theme. We help companies change their culture and have employers and employees come together and leverage health and their health plans to be a more competitive company in their workplace. So, it goes without saying, I think healthy workforces today are really a competitive advantage out there, and as companies compete more and more.
What do you see the impact of the latest regulations around wellness incentives being on your business?
Actually, very good. It's all about prevention. And I think what's happening in the medical world is that people really do realize that we're moving away from a culture of get sick, get help, and moving into one that's more preventive, where there's things that we all, as we age, unfortunately, have issues that we kind of ignore or rationalize away. Shouldn't have that extra glass of wine last night. I feel tired. But sometimes those things are related to your health, and we don't really go see a doctor about those things. We just kind of rationalize them away until they become a bigger event. So getting in front of these issues that are chronic in nature are the key to success for not only the individual, but also companies today.
Joe, this is Ron Bachman. This is a really active space, obviously, wellness. Everybody's trying to do various types of wellness programs, and I applaud you for your entrepreneurial approach to trying to develop something that really helps change individuals and brings about real successful wellness. But with so many companies out there, tell us a little bit about what makes you unique. What have you focused on? Do you have a specific target market? Is there a specific approach or product or service that really highlights what you're doing?
Great. Well, our biggest fundamental is that we're clinically based, which means we test employees and spouses and other dependent members through labs, real labs, venipuncture. And based on that information, plus their medical history and their age and sex, we interpret those findings in a very unique and scientific way. Let me give you some statistics that kind of drive my point. 63% of the employees that come through our health evaluations each year, and we do about 360,000 a year, will have not seen a doctor in over 5 years. So there's a big disconnect. Yeah. People don't go to their doctor routinely. What we find on the people that come through our health evaluation is 58% of them have an undiagnosed or untreated chronic issue. That doesn't mean they're real sick, but as I mentioned, there's things that are started. You have high blood pressure. Well, it's not severe, but you're starting down a slide. You have elevated cholesterol or glucose. You're starting to slide. You have liver or kidney function issues that are not normal. You're starting to slide. None of those things by themselves bother you, but when over time they start building up where you can create an event. In fact, 3% of the people that come through our health evaluations are what we call critical, which means they're life-threatening. They're walking around with glucose levels of 300 to 600. That's like almost like a coma to us. So these are the things that most employers think that people that come to work every day are the healthy ones. And reality is they are healthy, but they're not as productive and as healthy as they should be or could be.
Right. So are you focusing on what some would call biometrics, and is there a specific set of those measures, or is it just a big battery of tests that, again, you said it was clinically oriented, so that it's beyond blood pressure, cholesterol, nicotine use, body mass index, waist size? Sounds like you get in a lot more detail.
Absolutely. In fact, to that point, it is medically sound. It's something a physician would use as opposed to, say, a finger stick that a lot of companies may be using today. Nothing wrong with it, but it's not as medically sound as a lab draw. So the important thing about what we do is we have the ability to really evaluate every organ in your body, and how we do that is kind of unique. We call it smart testing, but basically what it is what we know about you is how we give you different tests. It's age and sex, but also you may come back when we test you today and we get a reading that you have a glucose level over 100, which is starting to be pre-diabetic. We'll automatically run an A1C, which really is a gold standard to help us really understand how over the last 60, 90 days have you been as far as diabetes is concerned. That gold standard really helps physicians as we connect them to their physician, help them get to their physician to really start making change in their life. So those are the types of things from a testing standpoint that the sophistication of the test today and the age and sex and early findings that add more sophisticated or confirming type tests really do make a difference.
Hey, Joe, once you've tested the population and you've begun implementation of the program, one of the biggest challenges in the marketplace is continuing engagement and participation, keeping the population active in health management. What do you guys do to really help employers with their population, keep them engaged and keep them participating?
That's a great question, because that is the holy grail. Because we're clinically based and we're outreaching to individuals that are at risk and working with them routinely throughout the year, word gets around that people are thankful for the help. They really feel for the first time someone's caring about them. So that word of mouth really does help. And we work with people who have risk throughout the year. But like you said, you have to really make sure things stay fresh and different. So there's all kinds of tools that we offer that allow anybody from any walk of life to want to participate in any way they can. Some employees can't or won't, or maybe they're not even on the health plan, go through the biometrics. But they want to still participate. As an employer, you want them to as well. So we have challenges, different games you can play, web-based. And rewards are associated with those kind of things, as well as the biometrics. So it really comes down to a culture that you're changing, and you're starting to make your health of your employees as strategic as you are about your product and services. So it's very visible. It's very out front. It's monitored, measured, rewarded, just like you do with anything you do, and it becomes part of your culture. So keeping it fresh with outreaches, webinars, seminars, reminders, as well as the outreaching to people at risk, really gives it a fever, no pun intended, of its own that really kind of drives that kind of freshness.
Some would say we're typically American. We want to get paid to do the right thing. If just being healthy was good enough, we wouldn't have the epidemic of obesity and even the smoking levels we have today. So the idea of rewards and incentives you mentioned, paying people, I guess, in some way, shape, or form. Tell us about the rewards and incentives and how that might be changing in what employers are willing to do in terms of rewards and incentives.
They're good, yes, because unfortunately, a lot of people think, well, everyone knows you're overweight. Everyone knows you're not healthy. Why aren't you doing something about it? I flip it around the other way. We've got a very strong workforce. There's two types of workforces today, unfortunately, the out-of-work and the overwork. And the overwork really are trying to do their best to hold on to their job and make things happen. So they don't want to take time out to go to their physician, so they try to rationalize it away. So I think there's a spirit that people really do want to do the right thing, but they just haven't had the opportunity. By bringing these things on site, it makes it convenient, which is real important. But the incentive is also important. Unfortunately, people need to be pushed a little bit. Mm-hmm. The best practice that we've seen is premium deductions or reductions of the incentive. So if an employee can earn, say, $1,000 less a year on premium, that really drives the outcomes. And that's what we've seen. Companies that are offering at least $600 off their premiums really do drive participation, and not just participation, but change. Mm-hmm. So that's really the best practice. With healthcare reform upon us, I don't know if the listeners know, but up to 20% of a single coverage premium per employee can be used as an incentive. That's significant money. Mm-hmm. It's now going to 30%,
right?
And it can go to 50%. So I think many employers are looking to use that not just from a premium reduction, but also maybe to help them drive other activities or learning things, being a good health consumer. And those are the types of things that we're trying to help people do. For instance, you can't afford your medicine. Well, you may not know there's generics. So we help people understand their health plan better so they take better advantage of it. So those are the types of little things that make a big impact for someone to stay on medication if they need it while they're working on their lifestyle.
Hey, Joe, I really appreciate that. These segments go by really quickly, and I want to give you an opportunity to give our audience, several clear takeaways on interactive health and how they can get in touch with you.
Great, I appreciate that. The key things is that we're an outcomes-based company, meaning that results count. we try to make sure people get rewarded for change, not just going through the activities. So if you're thinking from an employer standpoint of having some employee accountability, which I think is a healthy thing, majority win here, you can differentiate from people paying more or less based on how they participate and how they visit their physician and get under control. So I really think if you're looking for a performance-based health plan and a performance-based wellness solution, we're it. But we also know that some companies can't get that step done right away, and they need to be walked before they can run. And we have an array of products and services, not just from a clinical standpoint, but from an activity standpoint, that help start changing the culture so employees begin to really feel good about this. I think there's a lot of fear and anxiety out there with healthcare reform, but employers can take the lead here and say, listen, it's not about change as much as it is about health. And what's wrong with health? We all want healthy people. We all want to live healthy lives. And I think it's all a positive win-win for companies and employees to come together really for the first time around their health. That means something for the company, means more productive, healthier workforce, as well as individuals living better lives. So overall, I think if you're looking for those combinations or those things to help drive that kind of culture, we're a great fit.
And they can find you at interactivehealthinc.com, correct?
Exactly right.
All right. Joe, well, listen, I really appreciate it. Enjoy your weekend in Chicago, and thanks for joining us on this segment of Healthcare Consumerism Radio.